Hi friends, welcome to Curious Vet channel. I am Dr. Mohsina. So in today's video, I will be discussing about the different cranial nerves, their functions, examination and deficits. I am not going through the details of anatomy, but you can pause the video and just see the location of the origin of the 12 different cranial nerves. So coming to the first cranial nerve, the olfactory nerve, its function is to mediate the sense of smell. See the location of the olfactory nerve fibers in the inferior aspect of brain. You can see the olfactory nerves beneath the olfactory bulb also, which is shown in green color. So how we examine the olfactory nerve? Actually, it rarely has a primary neurologic problem in veterinary medicine, but we can examine by observing the patient sniff around. If there is any deficit, the patient has difficulty identifying the smells presented, and the loss of smell, the condition of having a loss of smell is termed as anosmia. Coming to the cranial nerve 2, the optic nerve, its function is to carry the visual signals from retina to the occipital lobe of brain. And we examine the optic nerve by 3 different tests. The first one is to drop a cotton ball and watch the patient follow it to the ground. But this test will examine only the optic nerve, that is the cranial nerve 2. And if there is any deficit, it causes a decreased visual activity because of the optic nerve damage. Another test is Meniere's response, but it tests for 2 cranial nerves, the cranial nerve 2 and the cranial nerve 7. Cranial nerve 2 for the visual cue and 7 for the blink response. So let's see how we conduct this test. A Meniere's response is elicited by a threatening hand gesture heading towards the eye of the animal. It is shown in this picture. But we should be careful because it should require minimal airflow during the gesture, and the physical contact also should be avoided. The test should be performed while covering the contralateral eye to prevent its contribution to the Meniere's response. And if there is a blink, it is considered as a positive Meniere's response. So a positive Meniere's response means both the optic nerve, the cranial nerve 2 and cranial nerve 7 are intact. Then coming to the third test, the pupillary light response or PLR, it tests for 2 cranial nerves, the cranial nerve 2 and 3. 2 for the visual cue and 3 for the pupillary constriction. So what is PLR? The PLR is the constriction of the pupil that is elicited by an increase in illumination of the retina. So how the test is conducted? Let's see. So we will direct some light like a torch or some source of light to one eye, and if there is constriction of pupil in the same eye, it is called direct PLR, and if there is constriction of pupil to the opposite eye, it is called consensual PLR. So you can see in this picture, light is directed to the left eye of the dog and it is showing direct PLR, but the opposite eye is also showing 50% pupillary constriction, that is the consensual PLR. Then coming to the cranial nerve 3, oculomotor nerve, its function is it provides motor nerve supply to most of the extraocular muscles, dorsal, ventral and medial rectus, and for pupil constriction. Examination is done by observing for physiological nystagmus when turning head, but it also involves the cranial nerves 4, 6 and 8. And another test is by observing the pupillary light response. Deficit. If there is deficit, there will be problem with PLR as we told before. Also, there will be strabismus of the eye due to the deficit in motor nerve supply of the cranial nerve 3, that is the oculomotor nerve. Then coming to the fourth cranial nerve, that is the trochlear nerve, what is its function? It provides motor function to the dorsal oblique extraocular muscles and it rolls the globe medially. An examination is done by observing for any dorsolateral rotation of the pupil. So if there is deficit, there will be strabismus of the eyes. Can see in cranial nerve 4 trochlear nerve damage, there will be strabismus, but this can also caused by the damage to the midbrain. And this strabismus can be seen with cranial nerve 3 and 4. Then cranial nerve 5, the trigeminal nerve, it is having 3 different branches: maxillary, mandibular and ophthalmic. It provides both motor and sensory functions: motor to the muscles of mastication and sensory to eyelids, cornea, tongue and nasal mucosa. Then how we examine it? Palpate the masseter and temporal muscles for symmetry, atrophy and pain. Also check the jaw tone and touch medial septum of the nose and look for retraction. Touching the globe and observing for retraction, also test cranial nerve 6 for the motor function. Then palpebral response, blink reflex when touching the medial canthus. Also it tests cranial nerve 7. Then pinching the lip and observing for snarl response. It also tests cranial nerve 7 for the motor. Then if there is any deficit, you can in the examination slide itself I mentioned what we will examine and what we won't examine in the deficits. But in veterinary medicine, one important loss of function is the loss of motor function in the muscles of mastication. That is very important as far as the diagnosis is concerned. Then cranial nerve 5 damage can cause we can test by palpebral reflex, then respond to stimulation of nasal mucosa and resistance to open the mouth. Then abducens nerve, cranial nerve 6. The function is it provides motor function to the lateral rectus extraocular muscle and the retractor bulbi. Examination by touching the globe and observing for retraction. It also tests cranial nerve 5, then observing for medial strabismus and observing for physiologic nystagmus when turning head. But this also involves cranial nerves 3, 4 and 8. Then deficits will cause the strabismus of the eye, mainly the medial strabismus. You can see medial strabismus in a dog and a cat in these pictures. And coming to the next cranial nerve 7, the facial nerve function provides motor function to the muscles of facial expression and sensory to medial pinna, taste to the rostral tongue, parasympathetic innervation to lacrimal glands and some salivary glands. The examination is done by Meniere's response as we told before and palpebral response, blink reflex when touching the medial canthus. Also test the cranial nerve 5 for sensory. Both we explained before. Then observe for facial paralysis, deviation of nose to one side or droopy lips. Another test is shimmer tear test. Then ear flicks in response to the stimulation of medial pinna. These are the pictures showing Schirmer tear test. It tests for the production of tear. So the deficit will cause exposure keratitis, because the cranial nerve 7 is the nerve responsible for lacrimation. So one of the important deficit is deficit in lacrimation. It also causes other deficits that we mentioned before. Then let's see the Schirmer tear test interpretations. That is, if the tear test reading is between 15 to 25, it is considered normal. 10 to 14, we can suspect low tears. And if it is below 10, it is considered very low. Then coming to the cranial nerve 8, vestibulocochlear nerve. The function is sensory input for hearing and head position. Examination by hearing assessment. Deaf animals may startle easily. Then observe for head tilt, abnormal nystagmus and presence of normal physiologic nystagmus. Deficit can cause nystagmus, but it also occurs with CNS disease or cranial nerve 8 deficit. Then coming to the cranial nerve 9, that is the glossopharyngeal nerve. It provides motor and sensory innervation to pharynx for swallowing with the cranial nerve 10, and also innervates some salivary gland and provides taste innervation from the caudal tongue. The examination is done by eliciting a gag reflex and observing for dysphagia. We will see what is gag reflex later. So if there is deficit, there will be difficulty swallowing and the impairment of taste over the posterior 1/3 of the tongue and palate, because it innervates the caudal tongue. Impaired sensation over the posterior 1/3 of the tongue, palate and pharynx, absent gag reflex and the dysfunction of parotid gland is also noticed in this deficit. Then what is gag reflex? The pharyngeal reflex, gag reflex or laryngeal spasm, all are synonyms. It is a reflex contraction of the back of the throat. How it is elicited? It can be evoked by touching the roof of mouth, the back of tongue, the area around the tonsil, the uvula and the back of throat. Then coming to the cranial nerve 10, the vagus nerve, it innervates the larynx, esophagus and pharynx. It also provides parasympathetic innervation to the heart and viscera. Examination: elicit a gag reflex, observe for laryngeal paralysis and assess for megaesophagus and regurgitation. Deficit will cause palatal and pharyngeal paralysis and also laryngeal paralysis. And there will be abnormalities in esophageal motility, gastric acid secretion, gallbladder emptying, heart rate and many other autonomic dysfunctions. And the cranial nerve 9 and 10, the glossopharyngeal and vagus nerve deficits, in both of them the swallowing reflex will be absent in 10 and the gag reflex will be absent in 9. So this is important. Then coming to the cranial nerve 11, that is the spinal accessory nerve. Its function is it innervates cranial cervical muscles, and it is rarely assessed and rarely a clinical problem as far as veterinary medicine is concerned. Anyway, how the examination is done, it is evaluated by testing the muscles it supplies. So let's see the muscles it supplies. First one is the sternocleidomastoid. The patient is asked to turn the head against the resistance supplied by the examiner's hand while the examiner palpates the active muscle, like opposite to the head position. And also for the upper trapezius, the patient is asked to evaluate the shoulders against resistance supplied by the examiner. Usually this test is done in human medicine, and it is of less importance in veterinary medicine. If there is deficit, supranuclear lesions of the 11th cranial nerve cause moderate, often transient impairment of function of the both muscles due to the bilateral innervation. There will be impairment of both these muscles. Then cranial nerve 11 or the spinal accessory nerve cause trapezius muscle atrophy, and you can see trapezius muscle atrophy in a dog. Then coming to the last cranial nerve, the 12th one, that is the hypoglossal nerve. Its function is it provides motor nerve supply to the tongue. And the examination by inspecting the tongue of the animal. And the deficit can cause atrophy, fasciculation and weakness of the tongue. Usually we can see a deviation to the side. You can see in this picture the tongue is deviated to one side. So here is a table of the 12 cranial nerves, and here it is numbered from 1 to 12, and you can see the names, and also there is a code to remember the name of the cranial nerves. On old Olympus towering top, a French and German viewed a hope. So this is a rhyme. It's a famous rhyme used to remember the 12 different cranial nerves, and here in this chart it explains the main function, not all the functions, only one or two important functions of each cranial nerve. It is olfactory, smell, then optic, visual activity, oculomotor, that is opening of eyelids, eye movement, trochlear, eye movement downward, trigeminal, facial sensation and chewing movements, abducens, eye movement lateral, facial muscle movement except chewing muscles and eyelid closing, then auditory, hearing and balance, glossopharyngeal, taste on the posterior third of the tongue, vagus, uvula, palate muscles and swallowing, accessory, shoulder shrug, then hypoglossal, tongue movement. So thank you. I have not gone through the too much details, but went through the important points of the function, the cranial nerve, examination of the different cranial nerve, and also the symptoms and clinical signs caused by the deficit of each cranial nerve. So if you like the video, like it and comment if you have any suggestions, and if you are new to this channel, please subscribe and click the notification bell and share the video with your friends. Thank you.